In fact, the NHS Confederation, which is an umbrella group for health service employers, has warned it will make an already tough financial outlook for the NHS even worse. The Confederation predicts the changes will cost the NHS more than £1 billion a year. Paul Healy is a senior economic advisor at the Confederation. I asked him how sure he was of that £1 billion figure.
The estimate that we've put out there is based on publicly available data. It's data that's from the NHS pensions account, which takes the number of people who currently are in the NHS state pension. It kind of looks at the total spend on pay costs. So there are some sensitivities to the data which may affect the figures, but we're quite confident it's going to be around.
It's round about £1 billion a year. That seems an awful lot, even for an organisation like the NHS. Has it been factored into government plans? Because they're planning to give you above inflation rises next year, aren't they?
Yeah, so it's difficult to work out whether or not it is from the government's perspective, because the plans around funding comes from an analysis in the 5-year forward view from NHS England. And when you look at that document and you look at the analysis behind it, it doesn't seem to reflect these costs. Most of the increased costs to the NHS is based on demand going up in terms of more people going into hospital, so it wouldn't seem to reflect these increased employer costs.
So the plan recognises that the NHS in England and Wales needs another £8 billion over 5 years. That's around £1.6 billion a year. But most of that, £1.1 billion, could be lost on increased national insurance. What would that mean for the NHS?
I think what we're most concerned about is that this pressure, when it comes in April 2016, will make a lot of organisations have to focus on meeting short-term priorities in terms of making their budgets balance. And I think the challenge for us then is that actually that may result in the long-term investment that we need, which is part of the 5-year forward view. It may see some of that investment postponed. And a lot of organisations will have no other option but to look at how do they make the current services sustain without looking at how they can invest in future services.
Paul Healy, David Robbins is still with me. David, the Department of Health says it doesn't recognise that figure, was the phrase it used, but it wouldn't give us an alternative. Do you think it's about right, £1 billion a year?
Well, when the government first announced this policy back in 2013, it said that the total cost of the public sector would be about £3.3 billion. The NHS is obviously quite a large chunk of the public sector.
Nearly a third, I think, isn't it? So it seems about right. And what extra cost will employers face then? Will they be more than the cost to employees?
Yes, because the employee rebate is 1.4% on a band of income. The employer rebate is 3.4% on the same band of income. So obviously the numbers are higher. The maximum cost per employee, again, is for people earning a bit over £40,000 a year or more, and that can be £1,163
per employee. That's a lot, isn't it?
For people earning over 40,000.
Yes, and obviously lower if they earn less. So employers, private employers, with the million people in these schemes, will be looking how to deal with this. What are their options?
Well, they've got three broad choices. Some will just swallow the cost and keep the scheme going, particularly if they haven't got many employees still in the scheme anymore. At the other extreme, some will close the scheme altogether and move the employees across into the defined contribution plan that they typically already offer for new staff. The middle way is to keep the scheme open but to modify it to offset these extra costs. If an employer wants to do that, the most straightforward thing it can do is to increase the employee contributions, ask employees to pay more towards the pensions we're building up. But of course, that's a double whammy in terms of take-home pay, because employees are paying more national insurance and at the same time will be paying more towards their pensions.
Yes, and we've been getting emails on this already, people saying it's going to cost them an extra £100 a month, and plus that maybe £30 a month on average national insurance. That's a big chunk.
Yes, some employers will decide instead of doing that, they will change the terms on which pensions build up in future, so maybe promise a smaller fraction of pay or something like that.
David Robbins of Towers Watson, thanks very much. And those changes that affect you happened in April. I mentioned emails. Bob has been looking at them. Bob Howard, what's been coming in?
Yes, we've had a couple from British Airways employees